A very good evening to all respected professors and my dear batchmates. My name is Shikha Shomani and today I am going to present on the topic of ESBL. So, excuse me sir, I can't change. Okay. So let's have a overlook what we are going to discuss here. First of all, introduction of ESBL, bacterial groups known to produce ESBLs, types of ESBLs, mode of action of antibiotics, mechanism of resistance in ESBLs, route of transmission, how it spreads, symptoms of ESBL, treatment of ESBL, beta-lactamase inhibitors, laboratory detection of ESBL, molecule detection of ESBL, preventions, and conclusion. So first of all, we should know what is the ESBL. ESBL is basically a certain kind of enzyme secreted by the gram-negative bacteria, which make bacterial infection harder to treat with the antibiotic. Let me give one example here. Suppose a person which is infected with certain kind of disease and we are giving antibiotic to him. Suppose we can take a antibiotic, but if a person ESBL positive, the same antibiotic will not function or work over the same person. So please next slide, sir. Hello, I can change the slide. Oh. So common ESBL producers. These are the following ESBL producers: Escherichia coli, Klebsiella pneumonia, Pseudomonas aeruginosa, Proteus mirabilis, Salmonella enterica, Neisseria gonorrhea, and Haemophilus influenza, and so on. So how the mutant are surviving here? So you can see in the first plate, the light green color microbial colony indicate the sensitive cell against the particular type of antibiotic, and the green light dark green color is a mutant colony. So rest of all light green color colonies has been diminished because of the activity of the antibiotic, but the dark green colonies are progenies are multiplying, as you can see, because they are transferring their R gene or resistance genes, or because of the certain kind of the mutation happen in the cells. So types of the ESBL, these are the following types: TEM, SHV, CTX-M, OCA. And how they are developing through the mutation, because the ESBL phenotyping has been changed, 16S RNA, the activity which is responsible for certain kind of the characteristics has been changed, and the plasmid mediated. How the beta-lactam antibiotics are works, here I have taken some example which are containing the beta-lactam ring in their structure. I have taken example of penicillin, cephalosporin. How it works, because the antibiotic access goes in the bacterial cell, it will attach with the penicillin binding protein PBP. It is bind with the PBP penicillin binding protein, it will activate, and it will break the bonding, or it will interfere the transpeptidase activity between the NAM and NAG, and the cell bacterial cell will restrict, and it will not be survived because of the activity of enzyme. So how the ESBL are surviving? You can see here the general structure I have present here of penicillin. You can see here the beta-lactam ring, and how the ESBL are working. They are restricting the beta-lactam ring of antibiotics, so that the antibiotic which are containing beta-lactam ring, it won't be work against a certain kind of microorganism infection. So route of transmission are various, such as the person-to-person contact, shaking hands, touching soiled object, healthcare professional. We can see here in this picture, hospital, because it contains the nosocomial infection, which are known as the hospital-acquired infection also, which basically found in the person who are working in the hospital or healthcare professionals. So you can see here the effluent water which is coming from the hospital. It is or it is coming into the rain, and it will go further to the ocean also. So it is transmitting from one place to another place, from one country to another, or international level it is also transferring. So how it is spread? I have given an example here. A patient A He is a ESBL positive, and it contains the bacteria which contain the R gene, which is known as the resistance genes, which are responsible for the ESBL activity. So when a person went in the hospital and came in contact with the healthcare profession which contains the ESBL positive microorganism, that microorganism had transferred to ESBL negative patient, and the gene has been transferred from, or plasmid we can see, it transferred from the ESBL positive to ESBL negative person, and the same person became the ESBL positive. So this is the main mechanism behind to become positive of ESBL infection. So what are the risk factors behind ESBL infection? Two onsets, community onset and the hospital onsets, recurrent urinary tract infections, previous exposure to the antibiotics, especially cephalosporin and chloroquines, corticosteroid use, previous hospitalization, nursing home residency, older age, diabetes mellitus, underlying liver or renal pathology, percutaneous feeding tubes, international travel, especially to Asia and North Africa. These are the most prone countries which contain the ESBL infections. Longer length of hospital stay, increased severity of illness, longer time in the ICU, intubation and mechanical ventilation, urinary or arterial catheterization, previous exposure to especially cephalosporins, involving central venous or arterial catheters, gastrostomy, urinary catheters, and hemodialysis. What are the symptoms of ESBL infection? The most and prominent symptoms is the frequent urination with burning sensation and pain before or during urination, redness skin, loss of appetite, stomach cramp, diarrhea, fever, excessive bloating, gastric problem, blood and stool, trouble in breathing, vomiting, and nausea. What kind of ESBL treatment we can give to a patient? These are the certain kind of medicine that we can give to a patient: carbapinone, fosfomycin, antibiotics. In antibiotics, colistin or non-beta-lactam antibiotics we can give to the patient. Other form is the beta-lactam inhibitors. This beta-lactam inhibitors, how it works, basically and bind to the beta-lactamase ring and protect the antibiotic from the dissection, which is dissection by the happening because of the ESBL microorganism. So it will protect the uh, ring from the dissection, and most especially when it bind to the beta lactamase irreversibly. Three most important medicine are carbonic acid, sulbactam, and tazobactam. So what kind of laboratory diagnosis we can use for the ESBL infection are the phenotypic method, screening method, confirmatory method, and genotypic method. But out of this, the PCR and the genotypic method are most widely used because it's a gold standard method, can detect all variant and easy to perform and labor to intensive. So prevention of extended spectrum beta lactamase infection are: wash your hand frequently, reduce the overuse of medicine, change bed sheet, use hand sanitizer. If a person is suspected or suffering from ESBL positive infection, isolate the patient, use the hand gloves. Here the conclusion. Hence, it is clear that the extended spectrum beta lactamase infection is highly contagious, and therefore it becomes necessary to take necessary preventive steps to avoid getting infected with it. Modification in the lifestyle and following healthier habits can assure you a healthy and happy life. So, wash your hand frequently and stay away from certain kind of infections. Thank you so much.
Thank you, Shika.